Ladies and gentlemen, welcome to our disease investigation project on lung cancer. It was created by public health majors
Reshma Jairam, Iris Blovin,
and Jasmine Presenti.
This graph shows the rise and fall of cigarette use and lung cancer deaths in American men and women for over 100 years. Factors like the Great Depression and the World Wars are associated with high cigarette use until after 1950, when there was finally evidence linking smoking and lung cancer together. Lung cancer is a leading cause of cancer deaths in America. In North Carolina, the mortality is slightly higher than national. The number of new cases is decreasing nationally across gender and racial groups, except for in Native and Pacific Islander women, whose rates have stayed the same. Exposure to first and secondhand tobacco smoke causes 90% of lung cancers. Environmental exposure to radon, asbestos, and air pollution account for a smaller percentage, but they are still risk factors. Social risk factors include being male, African American, and having low socioeconomic status. Small cell lung cancers make up 15% of all lung cancers. 85% are non-small cell lung cancers, which are more gradual and use staging. As the cancer progresses across 4 stages, the original tumor grows, spreads to lymph nodes, and metastasizes to other body parts.
Because lung cancer is the most common cause of cancer deaths, there are diagnostic procedures to confirm whether or not you have it. A few procedures are a CT scan, thoracentesis, and a surgical biopsy. A CT scan is an imaging system used to take detailed pictures of the lungs and to detect small tumors. Thoracentesis is when a needle is used to draw fluid from between the lungs and chest wall to be tested for cancer cells. Finally, a surgical biopsy is when tissues are surgically removed to test for the presence of cancer. Many treatment options are available if you are diagnosed with lung cancer. Surgery, chemotherapy, radiation, and immunotherapies name just a few of those options.
To prevent lung cancer, you should reduce your exposure to tobacco, radon, and be screened to detect cancer earlier.
Florida started the Truth Initiative in 1998. It targeted teens and put the tobacco industries on blast, exposing their shady practices. Then, in 2007, Florida voters spoke up on tobacco. They added an amendment to their constitution called Tobacco-Free Florida. It offers free resources for tobacco cessation, quitting 3 ways. This brought Florida's youth smoking rates down to just 5.
Radon is the second leading cause of lung cancer, causing 3 to 14% of lung cancers. People who smoke are at a 25 times higher risk of radon-linked lung cancer than those that don't. Where is there a lot of radon? More places than you think. Radon test kits are available cheap through many state health departments. The 5-year survival rate for lung cancer is just 2%. Because of this, prevention is vital. Most people are diagnosed in late stages. If screening took place earlier for those at risk, the survival rate would improve. Now, the Healthy People 2020 goals on lung cancer. Goals include reducing the cancer death rate and lung cancer death rate by 10%. North Carolina has met both of these goals already. Healthy People also has goals for tobacco. Goals for tobacco are divided into 3 categories: reducing tobacco use prevalence, increasing access to tobacco cessation, and changing the social environment and how it relates to tobacco use.
Thank you so much for listening to our presentation on lung cancer.
Created using Powtoon.